Hi, today we are talking about kidney stones, and this channel is Diagnosis Bona Corazza Bona, and my name is Dr. Dinara. In today's session, we're talking about risk factors for forming kidney stones in your body, investigations that can help us to find the kidney stones, and also about management. So let's get started. What is a kidney stone? It's a hard crystal-like mass that forms from waste products dissolved in your urine. So it can be formed from minerals like calcium, oxalate, uric acid, and the size of these kidney stones can be different. In many cases, it's just a grain of sand, very tiny, or in some cases, it could be very large, occupying the whole kidney and causing the obstruction, and also causing that it will be a very, very severe pain, which we call a renal colic. What's the risk factors for kidney stones? It could be a dehydration. It's the most common cause. Less water means concentrated sticky urine that can lead to forming these kidney stones. Diet, like a high salt diet, animal proteins in your diet, oxalate-rich foods, it's green leafy vegetables like a spinach we have, also some nuts. Family history as well as is very important because it runs in family. Medical conditions like obesity, gout. Gout can cause a high level uric acid in your blood. Recurrent UTIs, urinary tract infections, hyperparathyroidism. Parathyroid, it's a gland that next to your thyroid gland in your neck. And this parathyroid gland can cause a very high calcium level in your blood. And also Crohn's disease. Geography, it's of course it's linked to dehydration. And it's a hot, dry climate. It can lead that people will be dehydrated if they are not drinking enough water, because you need to drink much more water. Medications like diuretics, so you are losing your urine. Calcium-based antacids, so increasing the calcium level in your blood and your urine. Also some medications for migraine and HIV. What we can use for investigation, the gold standard CT scan, like in this picture you can see there is a CT scan. There are three colors. Black is air. Yeah, so the gray, it's a soft tissue, and white, it's a bones, as well as some, like in this case, it's hard structures, this stone, a kidney stone in the kidney. So it's like pointed with this arrow. Ultrasound is a good choice for pregnant women, for children, excellent for follow-ups, but sometimes we can miss some tiny stones when using ultrasound. Blood tests, so we will be checking the calcium level, uric acid level to find out the cause. Urine tests, we have to find some, if there is an infection. Stone analysis is crucial. Okay, and next, let's talk about treatment. Treatment depends on the site of the kidney stones. If it's less than 5 millimeters, it can pass by itself. But if it's bigger, we can use some interventions. Okay, so let's talk about if it's under 5 millimeters. It's a very tiny one, but it still can cause a very severe pain. We can use a medical expulsive therapy. We, of course, give you painkillers, NSAIDs. If it's a very severe pain, it also can use opioids. High fluid intake, so it has to be 2.5 liters of urine daily. Tamsulosin, it's a medication that can make the urine tract wider, and it give you like more chances to pass this stone. And strain, as I told you, I will be talking about this many times in this video. So strain to catch this stone is very important for us to make analysis to prevent in the future, because if you had it one time in your life and you are nothing changing in your life, there is a high chance that you can have them in the future as well. Okay, so let's if it's not passed in 4 to 6 weeks, we will be doing some active intervention. What we can do for bigger stones or smaller stones that can't be passed, it's a shockwave lithotripsy, non-invasive, quite effective. So we can break this stone, and it pass by itself like in the previous one. So with this good hydration, tamsulosin, pain relief. Also, we can break the stone with a laser, and it's usually for a bit bigger stone. That's why even we break it, it still will be quite the big pieces of stone. That's why we can use a scope to catch them. Yeah. Also, there is a surgery which is called a percutaneous lithotripsy, and we will be doing a cut at the back and inserting the instruments already inside, but we usually leave this type of treatment for quite the big stones. Yeah. Okay, so what we can also, we are, of course, these stones can cause an obstructed infected kidney and with a fever, flank pain, and cause a life-threatening condition which is called sepsis. For this case, at first we have to do emergency decompression. Like in this case, you can see CT scan again, and this kidney, left kidney, is even bigger. You can see, and there is no urine is just going down, but at some points can pass this obstruction. So that's why we can use urine drainage via a ureteric stent, a nephrostomy tube, everything that can help us to that the urine will be passing down. IV antibiotics is very important for fever, chills. So also it will be a high inflammation marks like ECR, CRP. So that's why we'll give you intravenous antibiotics. And when our patient becomes stable, he doesn't have a huge obstruction, not very high fever, the next step in this case will be stone removal. A bit more about medications. For pain relief, we can use the NSAIDs like Voltaren, Nurofen, but if a person already having a kidney problems, like a chronic kidney disease, we have to use paracetamol at first. Opioids is also can be used for pain. It's usually for very severe pain. If you are hypertensive and you are taking medications like ACE inhibitors, ARBs, like a perindopril, candecertan, you have to stop them during acute colic because they can worsen kidney function during this blockage. Yeah. What about preventive medications? If a person have a high calcium level in urine, we can give thiazide diuretics. If you're having a high uric acid, this person having, for example, a gout, we can give allopurinol for prevention. If urine is quite acidic, so we can give potassium citrate to prevent future kidney stones. So it's very important not to self-prescribe high dose vitamin C and vitamins and vitamin D, because it's also increasing the chance of having kidney stones. And in the past, if we advise calcium supplements, for now we are more and more avoiding it just for people with osteoporosis. But if you don't have any problems with your bones, please don't use any calcium supplements. Just increase your calcium from food, like dairy products. So please drink enough water. It will reduce the chance of having you kidney stones. If you have a stone, we have to catch it, analyze, and will be a guide exactly for you, for your kidney stone, that to prevent them. If you are having fever, it's an emergency. We have to start you on antibiotics. We have to resolve this obstruction as fast as possible. I also leave you these resources to read about kidney stones. And as I told you, so please, this video is just for information. It's not a guide for treatment, for investigations. In your case, you always have to talk to your doctor, with the urologist, or to your GP, and your investigations and management will be tailored just for you. Thank you very much for watching this video. I really hope that it will be helpful for you. And if you're having any questions, please leave them in the box down below. See you in the next video. Bye bye.